What's up guys, Dr. Brett Rollison with Ground Overhead PT, coming at you again with your daily body armor. If you haven't done so guys, go ahead and subscribe to the channel. We're putting out videos daily to give you guys some training and rehab ideas so you get back in the gym or back to whichever sport you guys enjoy, okay? So today what I want to talk about is the pain on the side of the hip, okay guys? Especially near that bony prominence on the side, okay? So a lot of times with running and jumping athletes, people that are putting in a lot of miles, people that are starting a new lifting program, they start to develop this deep achy pain on the side of the hip. If you press onto that bony prominence on the side, you get a sharp pain. This can be due to a number of things. It could be an inflamed bursa, it could be a tendonitis, it could be a strain of one of those muscles. But either way guys, we want to attack it by actually strengthening that area to one, get the pain under control, but to also keep it from ever coming back, okay? So particularly with a lot of our runners and people that are playing sports, they get a lot of that collapsing of the knee, collapsing of the arch of the foot, which then leads to compressive and tensile forces on the side of that hip, okay guys? So it gets inflamed, gets angry, and then you gotta take a few weeks out of the gym, okay? So what we wanna do is start initially strengthening it. So most of you guys have done a traditional wall squat, but we're gonna add in another component. So what you're going to need is either a weightlifting belt or a belt that you wear around the waist at the office, something that just doesn't give, okay? So none of the resistance bands. So we're going to take the belt, we're going to place it just below my knees. I'm going to back up against the wall, and just like a normal wall sit, I'm going to go down until my thighs are at 90 degrees with the floor. From here, I'm going to drive my knees out into the band as hard as I can without pain. So right now I don't have any pain, so I can press really hard, but if you're starting to feel it, you get that sharp pain, if you're grimacing, it's too much. So kind of meet that pain, but don't cross over that threshold. So pressing into the band, I want you to try to hang out here for at least 30 seconds, okay guys? Now, a lot of you are gonna find this actually pretty difficult, and after 10 or 15 seconds, the legs are gonna be shaking, especially with that added component of driving the knees out. But I want you to try to get through 2 or 3 sets of 30 seconds. And what you're going to find is start to build some strength through the sides of the muscles of the side of the hip. Get the pain down so you guys can get back in the gym, start lunging, squatting, playing sports, or going back on your runs and without any pain. Okay, guys? So give that a try, and then tune back in tomorrow for another video on how to tackle that hip pain. Okay, guys? Have a good one.